morning, Prof. Presented to you all the psychosocial variables and also some other lifestyle variables that affect cognitive impairment. And we know that in the literature there's so many factors that are affecting the risk factors of MCI. And some of them are education, occupation, income, social and mental activities, social risk factors, and psychological stress. And past studies have investigated a number of risk factors for MCI, which included loneliness, religiosity, social engagement, social participation, as well as health-seeking behavior. So in this particular study that we're doing, we focus on the modifiable risk factors for intervention purposes and non-modifiable risk factors for identification purposes, because there's no point studying the non-modifiable because we can't do anything about it. So we're focusing on the modifiable factors, okay? And the project is, and this is the description of the project, and this is the objective. And specifically, we want to identify the psychosocial and economic risk factors for cognitive impairment in old age, and to quantify the present and future cost of care for age-related cognitive impairment to individuals, family, and the community. And this is the first ever research on quantifying the economic cost of care. And we also wanted to assess the cost effectiveness of intervention programs in delaying the onset of age-related cognitive impairment, because we feel that prevention is a way to go. So how much does it cost for us to do the intervention programs? And lastly, to investigate the socio-economic impact of the population aging to the labour market, healthcare system, social protection, and legislative policies at the national level. So my project is both a macro and a micro project and initiative. And this is basically our conceptual framework, because we want to identify outwardly the identified psychosocial risk factors and quantification of cause of cognitive impairment. And we would like to look at the stressful experiences, the health, functional, lifestyle behavior, personality, spirituality, coping, and locus of control, social relationship and support, and all of the rest are here. And we have the baseline data, and also we have a subsample of cognitive impairment, where we do carol intervention and so on. Okay, this is our research framework. We want to do the SES, the environment, the psychosocial risk, the social risk, economic risk, and we have intervention of the psychoeducational intervention program, and hopefully we will get the cost of care. So I'll be sharing with you some of the data that we already captured from our first survey. And as Prof. Susanna mentioned this morning, just to recap of our sampling, it's a multi-stage sampling, 4 states, randomly selected 35 census circle with at least 10% of all the population, and we selected randomly 20 living quarters. And basically, when you talk about this distribution, the data actually more or less parallels the national statistics of older persons. So our methodology is sound. Okay? And these are our analytical variables for my presentation. We look at the SES as an antecedent, we look at the psychosocial and health factors, and the psychological distress factors. Okay? So at the bivariate level, meaning that we just go and cross-stack these variables that we have against age. We're using in this presentation, I'm using 4, the MMSE score, the MOCA score, the DigiSpan, and also the object recall. If you look at these variables, age affects all of that, sex also, but not for object recall, ethnicity for MMSE, but not for MOCA, marital status for all variables, and employment for 3 variables, and personal income for all, household income for all, household size doesn't affect all these other dependent variables. In terms of the second block of variables, you would see that have problems. This is the number of health problems, only affected MMSE score. But the number of chronic problems also affected MMSE score, and social support affected mini-mental and also MOCA score and the digit spec. Religiosity is affected, it is influenced MMSE and also digit spec, life event and so on. But I'll just give you a summary later on. So, and the correlation is significant at both 0.5 and 99% level. And when I did a multiple regression in the analysis using all the significant bivariate levels for MMSE, you see that chronic diseases, social support, religiosity, and life events, plus neurotism and life satisfaction really affects MMSE. And similarly, if you look at MOCA, digit span, and object recall, there are some variations in the variables of concern. Okay? And this is when we did the block entering of the MMSE score. All three models are actually significant. Okay? And but the measurement is only about 50%, 16%, and about that percentage. And if you look at MOCA, it is 13%. It's less than the MMSE score. But if you look at the correlates of MCI using MMSE, it is the lowest score is affected with less education, older ages, Malay, female, higher religiosity, poor life satisfaction, and lower social support. But for MOCA, it's more or less the same. Education plays a role here. Female and not married. So the marriage didn't appear in the MMSE score. The next one, when I did that interaction between MMSE score with education, you can see that the variables of female, lower income, Malay, and more life events, poor life satisfaction and unemployment and not married, and more stress affected the mini-mental score, and the R-squared has increased from 16% to 26%, meaning that there is a very strong role of education in our cognitive impairment. So this is where we need to have intervention for education, for literacy, for the whole spectrum of the population, because you see from here and also from Prof. An's presentation, education is a vital factor in influencing your mental health. Okay? But for MOCA, lower score was associated with older ages, female, lower income, depression, unemployment, lower life satisfaction, not married, and higher stress. And it has increased from 13 to 23. So meaning 10 points jump when we do an interaction when we control for education. Okay, so education is a very, very vital role in the human resource of the nation. Okay, and this is a perception of health as self-reported health. I'm not going to go through here all of this, but it's hypertension is number 1, cholesterol number 2, and diabetes is number 3, and joint pains. These are all easily modifiable situations. Okay, I'm not going to do that. And if you look at self-reported health, of those who have reported about self-reported health, 24% have illness, and 76% do not have illness. And out of that, 46% says I'm well most of the time. And we also ask a question: those who are sick, where do they seek treatment? Majority, of course, goes to the government clinic and government hospital, and very few went to private clinic and others. Okay? And in this survey also, we asked about the healthcare utilization. This is the outpatient for the last months. If you look at the number of visits, the highest is in the government clinic, hospitals, and private clinics. And more or less, government clinic and hospitals, about 80% of the places where they go, where they seek treatment. And utilizing the health survey in the past 6 months, about 60%, 62% of them are there. And average visit is about twice. And these are the cases. There are 800 over patients who visit this government clinic. And this may be a repeat behavior. And this is an example of the cost of care in one visit, because we collected seven times the cost of care. But for today, I'm just going to present to you just one visit. The time spent in the facility and in the government clinic is about 96 minutes. Okay? In the government hospital is about 109 minutes. In the private clinic is 50 minutes. The first one is in minutes. Yeah? These are our time spent in minutes. And the second one is a fair cost to the facility. This is a transportation cost to the facility and distance from home to the facility. You look at the government clinic, of course, it's closer to that. And then expenses for meals at the clinic, that's not crucial, but if you look at the total charges at the facility, government clinic is 2 ringgit, government hospital 58 ringgit, a private clinic 62, and you look at the private hospital cost, 328 ringgit, and traditional medicine and so on. And the total expenditure for one visit is on average, government clinic is 131 ringgit, government hospital 500 over, private clinic 6.1, and private hospital 6.7. And these are the things that, of course, we need to do more of this. But this is the first time we get to quantify the cost of care. And there are other variables in this, but I'm not going to present the detailed explanation of the cost of care. But this is the first time we got the data. And this is outpatient. We also have inpatient cost of care, which is not presented here. If we look at the healthcare utilization in patients, in the last 6 months, still is the government facility is the highest. Okay? And this is the type of healthcare facilities for admission for the first time admitted, and the length of stay in the healthcare facilities in government clinics is 2.6 days. In government hospitals, 7, in private clinics, 6, and in private hospitals, 3. And number of days absent from work after discharge from healthcare, and fair cost to the healthcare facilities, distance from home to health, and so on. So if you look at the total hospital charges in the healthcare facilities, government clinics is 10 ringgit, government hospital is 700 over, private clinics 56, and if you look at private hospital, it is 8,000. That's the cost that we have to pay. Yeah? So in conclusion then, the socioeconomic factors such as age, education, and sex or marital status affects the level of MCI among community dwelling elderly. Education is really a proxy indicator of the SES, closely linked to gender, income, and employment. Psychosocial factors such as stress, social support, and religiosity may influence the level of MCI among community dwelling elderly, but are poor predictors. Combined socioeconomic and psychosocial factors account for 1/5 to 1/7 of the variance in the MCI score. So that's about it in my presentation. We'll do a Q&A later. So I'm doing it quite fast. Faham tak? Boleh dapat tak? Jadinya pentingnya kita mengamalkan ataupun keep on learning in old age so that you can stimulate your brain, so that you can delay the onset of MCI.